But the idea behind this project is how can we systematically report on those variants that we are monitoring, the ones that are currently causing issues to the industry, but also how can we add some sort of prediction and kind of see, okay, which are the variants that we believe could potentially cause issues in the future, right? So that's the idea of this project. So we want to report monthly, so in sort of close to real time what we're seeing in the field.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name is Dr. Clayton Johnson. I'm the host of the podcast. And joining us back in our podcast studios is Dr. Mariana Kikuti. Dr. Kikuti is an assistant professor at the Department of Veterinary Population Medicine at the University of Minnesota. Mariana, thank you so much for coming back on the podcast. It's a pleasure to have you here again. If you would, why don't you start with a little bit of an introduction for the audience?
Perfect. Thank you. And thank you for having me again. I have been here before, so in case you haven't heard the previous podcast yet, my name is Mariana. I'm a veterinarian from Brazil, and I have been working with public health epidemiology for a while back in Brazil, and then I came to the US and started working with swine epidemiology, where I've been working mostly with PRRS and PED, but also working with other diseases such as Seneca and PD-COVID as well. And then for PRRS in particularly, I have been working a lot with monitoring PRRS viruses in the US with the MSHIMP project. So yeah, that's a brief summary of what I do.
We are here today to talk about some of your work with monitoring PRRS, epidemiology in the United States. And Mariana, I think it can get very confusing for folks like myself very fast because we've made so much progress diagnostically in recent years. I think everybody understands that the old way of naming viruses, the RFLP pattern, is not a very good way, right? It's not. It doesn't really tell us a lot about how closely related viruses are. And I think we've all embraced that the lineage system is maybe a better way to do virus naming. But it would be good before we dive into the discussion on PRRS variants for maybe you to kind of give us an overview of, okay, lineage is step one in naming the virus, but what does steps 2 and 3 look like? And ultimately, how do we get to, okay, this is a variant level of nomenclature for a specific strain of PRRS?
Perfect. I like to do an analogy with RFLP, which is a city name, for example. So let's say St. Paul, where I am here right now. RFLP is like city name, right? I can say a city and say, okay, I'm in St. Paul right now. You can assume that I'm in Minnesota, which I currently am, but there's also several other St. Paul cities in the US or in other places as well. So it gives us some of idea of where I might be, but it's not a precise location, right? So RFLP is a little bit like that. We have some idea of the characteristic of the virus, but we don't really know where it falls in relation to other viruses. So this is the RFLP. For lineage, I like to make the analogy of lineages and variants as first name and last name. So, for example, your name, Clayton Johnson, right? If I say I'm talking to Dr. Johnson, of course, depending on the context that I'm in, I cannot immediately assume that I'm talking about you, but there might be some other doctor, I don't know, John Johnson somewhere that it's either a veterinarian or a physician or something like that. So we don't have that precise information as well about who is the person that I'm talking about, right? So with PRRS and lineage is quite similar. So lineage would be similar to a last name. So I have some idea of the family. So I know that it's the Johnson family, right? But I don't know necessarily which individual I'm talking about. So the variant classification is kind of helps in that sense because it's attaching a first name to that last name. So, for example, in PRRS, we have the very famous now variant that is L1C.5, right? So L1C would be the lineage/sublineage. So lineage 1, sublineage C. And then the 0.5 will be the variant. So 1C would be the last name and zero point 0.5 would be the first name. So I think that kind of helps us understand a little bit that we are talking about the L1C family. So we know that everything that has that first designation is within the same family of viruses. And then we can kind of pinpoint, okay, we're talking about this particular individual here. So I hope that kind of helps a little bit understanding the variant classification.
Perfect. Lineage is a number, sublineage is a letter, and then the variant is the next number after that sublineage. That's a perfect setup. Well, talk to us about your project. You're looking at specific variants of kind of concern or the variants that get a lot of attention. What are you guys doing to look at those and monitor those?
Exactly. So this is an initiative from the Swine group here at the University of Minnesota, and it combines multiple projects from several faculty here at the university. We have been monitoring first variants in the past. We actually had one of the previous podcasts discussing some of the variants that we were monitoring. But the idea behind this project is how can we systematically report on those variants that we are monitoring, the ones that are currently causing issues to the industry, but also how can we add some sort of prediction and kind of see, okay, which are the variants that we believe could potentially cause issues in the future, right? So that's the idea of this project. So we want to report monthly, so sort of close to real time what we're seeing in the field regarding circulation of different first variants. So people can come and see, okay, I have currently we have about 170 variants circulating in the US. So of course, I don't expect everybody to understand, which variants are which. So the idea with this report particularly is for us to be more transparent and say, here's the list of variants that we believe could potentially cause issues. And this is scaled into first variants under monitoring classes from 1 to 4. And these classes are kind of similar to hurricane classes, right? So we know that depending on the number of the class that you have, the hurricane can be more or less severe, right? So it's the same with the variants under monitoring here. So we have variant classification category 4, which are the ones that are the highest concern right now, those that are affecting the highest number of herds in the US. And then we have the categories 1 and 2, that are the ones that are affecting a lower number of herds, but that we believe we should still be monitoring to see if they're going to increase in transmission or not, right? So it's just a place that people can go and say, okay, what is the biggest issue right now? And then I can also say, okay, I have a report from the VDL saying that I have a 1C point 5.37, for example. Where does that fall in that classification, and how can I understand the circulation of that particular variant that I found in my herd?
Are you doing this at any sort of a regional level yet, Mariana, or is it just the entire U.S. industry is all being categorized in that 4 category system?
So this is a U.S. So nationwide categorization based on number of sites affected. So this is not based on sequences, right? Because we want to be very specific in the sense of identifying the burden of these variants in the population. So this is nationwide. We do have descriptions of which states those variants are being reported to. And eventually the idea is to expand that project and kind of see if we're finding space-time clusters occurring of these variants and whatnot. But right now, out of the bat, we are reporting nationally.
And how do you assign or value the risk factors to decide this variant is going to be a category 1, this one's a category 2? Are you using the prevalence of how broadly spread across the U.S. it is? Are you using the number of cases that are positive, the CT value, the feedback from the field? What's all the criteria that goes into determining which category the variant gets placed in?
And we have 2 steps over here. The first one is that we have from Dr. Kim Vanderwall, we have a prediction model that kind of estimates based on sequence count and genetic information what are the variants that can potentially increase in frequency in the next 12 months. So this is the first step of identification. So all of the variants that are identified through this prediction model we classify them as variants under monitoring because we're going to look at them at some capacity, right? Whether that is just looking at case counts and that's it, or just doing a more complete follow-up on those. So all of those would be the variants under monitoring. And then the second level would be the number of sites affected by this variant. So for this, we are actually considering the number of sites in the past 6 months because we also don't want to value too much those historical epidemics that we have in the past, right? So we want to know what's currently circulating. So the second level of classification would be based on number of sites affected in the previous 6 months. So category 1 would be those with less than 30 sites affected in the past 6 months. Category 2 would be the ones from 31 to 50 sites. Category 3 would be from 51 to 100. And category 4 would be those that have more than 100 sites affected in the past 6 months. So those would be, for example, the one C5.32 right now that we all know that everybody is having issues with that. So that would be a category 4 variant under monitoring. And then for all of the variants that we have that are level 2 or category 2 or higher, we also describe what is the knowledge, the scientific knowledge that we have so far. So all of the studies on virulence, even what we see from reports from the field on what clinically what's going on with those variants, we kind of summarize those as well.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
Mariana, for somebody that wants to see maybe a full list of how you've categorized the variants and keep track of this going forward, where can they find your work? Where can they stay up to date?
Perfect. So this is being hosted on the MSHIMP website, so mshimp.umn.edu. These reports are updated monthly. They are also going to be distributed through the MSHIMP participants list. So if you're a participant or if you're enrolled to receive the MSHIMP updates, you're also going to receive those via email. And then the SHIC website is also linking, or the SHIC newsletter actually is also linking that those reports every month as well.
Fantastic. Great information. PRRS is no fun, but helping to understand, what strain we have and what sort of predictive capabilities we can have, right? The prognosis is valuable information. Thank you so much, Mariana, for doing it. And thank you so much for coming on the show and talking to our audience about it.
Thank you so much. And then I also wanted to say that we are doing all of this just to improve situational awareness, right, for everyone, for producers, for veterinarians, for researchers, and just increase transparency on what we're seeing that is happening in the field and what the ones that we also think deserve a little bit more attention as well. So thank you so much for the opportunity to talk a little bit about that today.
My pleasure. And Mariana, we have to thank the audience, because if we didn't have people listening in, we wouldn't be able to keep making these podcasts. Thanks to everybody who's listened in. If you haven't checked out our website, please do so. It's swinehealthblackbelt.com. And take a moment to like and subscribe to the podcast if you would. I know that's a silly request, but that really helps to drive the algorithm that gets us to a point where we can have more people that are going to get this good information. For Dr. Mariana Kikuti, I'm Dr. Clayton Johnson. It's been our pleasure to have this chat with you today, and we hope you have a great rest of your day.